Okay. Good evening, everyone, and thank you for joining us. My name's Jamie Adkins. I'm the Vice President of Business Development at MedShift RX, and I am very excited to welcome you to tonight's webinar, which is Optimizing Brain Cognition and Sleep and the Clinical Application of these Peptides. So, at MedShift RX, I want to say that we are especially proud to be partnered with Agari Sciences to bring this level of education to our customers and our partners and our colleagues. And our shared goal really is to help elevate the aesthetic and wellness space through meaningful peptide education, which, as you all know, it's an area where we're seeing tremendous demand, but still limited accessibility. So we're also excited to hear from Heather Vermette. She's the president of Agari Sciences, who's going to provide her perspective on recent changes and developments within the peptide industry. And as you know, everything's changing on a daily and weekly basis. So it'll be great to hear from Heather on what's happening right now and what's to come. And then we also have, and we're honored to have Dr. Derek DeSilva joining us this evening. And Dr. DeSilva, as many of you know, is widely recognized for his expertise in peptide therapies, and he's going to be leading the clinical portion of today's event. And then I guess I'll just dive right in and saying that I know many of you are experiencing in your practices that patients are increasingly looking for solutions around cognitive performance, anxiety reduction, and sleep optimization. These are complex challenges that require more than just surface level approaches, and that's where targeted peptide therapies and NAD plus can really play a powerful role. So tonight we're going to take a deeper clinical look on how these therapies work. Dr. DeSilva is going to explore the neuropeptide landscape and how specific compounds interact with the central nervous system. They provide stress and anxiety support and cognitive enhancement. We're also going to cover the critical role of NAD plus in cellular energy and neuroprotection and discuss how stacking these therapies can be more effective for patient outcomes. The goal of tonight's event is really simple. We want to provide you with practical, evidence-based insights that hopefully you can take back to your practice and apply with confidence. So, on behalf of the team at MedShift RX, I just want to thank you again for joining us. We hope you find tonight's presentation valuable and actionable. And with that said, I'm going to turn it over to Heather to kick off the event.
Thank you so much, Jamie. And we really value our partnership with MedShift. This is definitely a strategic partnership, and we can see the value here of the practitioners that we're working with. We got an opportunity to meet some of them actually last week in Atlanta. So I'm Heather Vermette. I am president of our chemical company, which is Pure Peptides. And then also within our portfolio, we have Agari Sciences, which is our company that does the finished vials out of our CGMP ISO 9001 facility. We have some amazing innovative products that we're going to be releasing soon, as well as the existing portfolio. So today we're going to cover with Dr. Derek DeSilva some things related to brain, cognition, sleep. So Dr. DeSilva, if you've not met him already, Dr. DeSilva comes from us from New Jersey. He also has a practice in Naples, Florida. He is he has a faculty position with Hackensack Medical Center in New Jersey. He is also on the board of directors with a hospital in Aruba Medical and Training Center. And he is a published author, and we are pleased and excited that we have Dr. DeSilva joining us today. He is our chief medical director and helps us out with a lot of protocols, therapies, and as we put together innovative new formulations, he is key to that business. So with that said, I'm going to turn it over to Derek. Thank you.
Thank you very much, Heather, and Jamie. Thank you very much once again for the opportunity to join you this evening. I think if you ask patients, what is one of your primary concerns with regard to aging? A lot of them in the top three, you're going to have people say, my brain. I don't want to have this dysfunction. So I would like to really begin by going over a couple of things when we talk about medicine. I'm an internist, so traditionally trained in internal medicine. When you're looking at cognition, folks, I think there are a couple of things that we all have to be very, very aware of. One of the things I want to do is when I have people come in and say, I want to, my mother or my grandmother or whomever is having some cognitive issues, would you please check them out? They'll come in and say, well, can I use this peptide or can I use these hormones? Yes, the answer is yes, but make sure that you do a really good assessment when it comes to cognitive decline. So what does that assessment look like? What does the blood work look like? And for me, obviously the basics, right? You want to do a metabolic profile, which is a CMP, complete metabolic profile. You want to have a CBC, obviously. You want to also look at, and this is a very important piece, you want to look at people's lipids. You don't want their lipid profile, their total cholesterol, to be 100. Because remember, the brain is 60% fat. So the way the brain communicates is how? Is through those fatty coverings on the neurons. And that's how they talk. That's how the axons and the dendrites, they all communicate with each other, is through that fatty layer. What's their vitamin D level? Do they have a methylation problem? Do they have a problem with an elevated homocysteine that is going to predispose you to cognitive decline? We know that. That is very well described. So, do you have a methylation issue where you can't methylate and the B12 is not being used properly and homocysteine levels go up? Do you have a problem with ferritin? Is your ferritin too low? Because you're now going to diminish your oxygen carrying capacity. God forbid you've got a more serious pathology. This is where an evaluation with perhaps an MRI or a CT comes in, ruling out any other major pathology in the head. Thyroid. If your thyroid is underactive, you are much more predisposed to developing cognitive dysfunction as you get older. If you're menopausal, as your estrogen levels go down, what happens to your brain, your memory, your focus? So all of these pieces and all of these together is what you need to evaluate. Then you can say, okay, I can use some Selank, I can use some Semax, I can use some NAD, but you have to make sure that you rule out the obvious when you do this type of a workup. So let's begin by the cells or cellular function. Oh, by the way, the other thing that you also have to make sure is you rule out any infectious processes. So where do they live? Do they live up here in the Northeast? I'm in New Jersey right now. Do you live up here in the Northeast where the ticks are just rampant? Do you have Lyme disease? You have to rule out the other infectious causes. So there are a whole lot of other pieces, and I have a whole protocol, by the way, that I use to evaluate somebody that comes in with cognitive decline. What are their omega-3 levels look like in their serology? So these pieces will fit together. And one of the presentations I do is optimizing the body on a cellular level to optimize how the peptides will work. Because if you build a foundation, ladies and gentlemen, you're going to have better results. What's your gut? We are now starting to realize that the oral microbiome is one of the major drivers when it comes to cognitive decline. People that have used mouthwash every day for 50 years, ladies and gentlemen, nobody, and I say nobody, should be using mouthwash because you're completely destroying your oral microbiome. So, again, little simple things that you really need to be aware of. What about plastics? What about heavy metals? All of these things poison the brain. And just to give you one more little tidbit here, I as Heather said, I live in New Jersey. My office is about 30 minutes from New York City. During 9/11, we were literally, our hospital was on standby for any other trauma patients that came in. The reason I mentioned that is we are now, I have three patients in my practice that have Parkinson's. They were all at 9/11. They have no history of other neurologic diseases in their family. But all three of them, ironically, were at 9/11. They were helping with cleanup. There were firemen, police officers, etc. The reason I mention this is that toxins have a major role in damaging the nervous system because you have to clear toxins through the liver. If you can't clear the toxins through the liver, they become a neurotoxin. So again, I want you to keep all of these in mind as we go through this. So let's start with NAD. It's the energy, folks. If you don't, and if you look at this line under all of these products, and again, a very special thank you to Jesse, who is an amazing tech person who puts all of this great stuff together. But a special thank you to him. And I love the way he did this, fueling every cell in your body. It's the cell battery. If the battery is not working in the car, you're never going to start the car. It's not going to work. So energy becomes a very important piece all the way through your body. Whether it be your brain, your heart, your kidneys, your liver, it doesn't matter. Your eyes, it all comes down to cellular energy. So how do we fuel that cell? And one of the best ways to fuel that cell and to power the mitochondria is with NAD. So it's a critical coenzyme. It's found in every living cell. It powers the mitochondria, and it's the battery. The mitochondria, the battery, it produces the energy. And also, it produces and enhances the energy. What is aging? Aging is loss of cellular energy and the inability of the cells to repair. So if you can keep the energy and you can continue to repair, what's going to happen? The car is going to run forever. Energy restoration is what NAD is all about. And if you have that energy cognitively, the brain fog is going to go away. Now, that being said, what's the thyroid? What are the hormones? What's the D level? And what's the B12 level? So again, I'm going to come back to that foundation of making sure that the foundation is set. Yes, it has anti-aging effects also. And I don't like the word anti-aging. I like the word optimal aging. So activating those longevity genes, repairing the damage, and of course, metabolic support. And if you look on the side here, if you look on the side where it says who this is for, this is really what you really need to know. People with chronic fatigue syndromes, executives that need a little bit more mental clarity, a little bit more mental sharpness, athletes who want to recover, because what's recovery? Recovery is energy. The more energy that you have, the faster you're going to recover. And by the way, mental oops, mental sharpness. Oops, how did I do that? Sorry about that. I'm going the wrong way here. There we go. Sorry. So mental sharpness, again, making sure that your omega-3 levels are optimal, because that too, omega-3s, what do? It enhances mental clarity, mental sharpness, increases the ability and the availability to think. So NAD, a great support as we go from there. What about a deep sleep restoration? Well, regulating circadian rhythms. What are circadian rhythms? We all know circadian rhythms. They are the rhythms, they're the cycles that the body follows. Why does the rooster crow in the morning? How does it know to wake you up at 5 a.m.? The reason it knows how to why to be woken up at 5 a.m., for those of you that have ever been woken up by a rooster, is because of their circadian rhythms, their circadian patterns. One of the biggest issues that we have when it comes to cognitive decline is the inability to sleep. If you don't sleep, your glymphatic system will not function. So, what's the glymphatic system? We've all know about the lymphatic system, right? It's the system in the body that helps with cleansing and cleaning. It's the waste system of the body. The glymphatic system, Glymphatic, the glymphatic system described, when was it described? In the late 1900s, I believe, or early 2000s, is a system that cleans the nervous system. It cleans the central nervous system, the brain, the spinal cord. The central nervous system is what is cleaned by the glymphatic system. So it's the lymphatic system of the brain, if you will, called the glymphatic system. When does this get activated? It gets activated when you sleep. It functions much more efficiently when you are asleep. 60% better function when you sleep. So what happens if you don't sleep? If you don't sleep, the chances of accumulating tau protein and all of the other junk in your brain is going to improve, is going to get augmented. So sleeping becomes a very important piece. People with chronic insomnia is who this is for. Individuals with high stress, cortisol levels being too high at night, you can't sleep, you got to get that cortisol level down. It's almost, and I compare this to an adaptogen. What's an adaptogen? An adaptogen is a substance, it's usually a plant, it's a botanical, that balances your system. It regulates your body and it helps regulate circadian rhythms. So, a very interesting side note to that. So, deep sleep inducing peptide is a neuropeptide that helps get you back into that delta wave sleep and helps regulate the body's circadian rhythms. Here's the other thing, and I'm going to go back to my internal medicine. Why aren't you sleeping? What's the issue? Are you snoring? If you snore, you're not going to, and you don't, and you have apnea, you're not going to get into that delta sleep. So the other thing that I see is I had a patient who came in Monday, just this week. He was on 4 blood pressure medicines. The first thing that I asked him is, how's your sleep? Do you snore? Do you wake up and catch your breath? And he said yes to all 3. What does he have? He has sleep apnea. You will never fix his blood pressure if he's got sleep apnea. So I ordered a sleep study, and I will guarantee you that that's going to be, he's going to have at least moderate sleep apnea. So making sure that everything's been ruled out, and then not everything, but you can help these folks, but don't forget to do and rule out certain things. Increasing the duration and quality of delta wave sleep, critical. Circadian rhythm regulation, critical. Modulating cortisol, right? You don't want cortisol levels to be elevated at night. You want it to be at physiologic low levels. And then pain. Folks, people with pain, they cannot sleep. For those of you who've ever been in pain, I mean, I hurt my knee, I've had knee problems for years due to all the craziness I've done. And if I do too much and my knee's hurting, it wakes me up. So again, you don't get into those deep levels of sleep. Chronic insomnia is something that this helps with. High stress cortisol, shift workers. This is a huge issue with shift workers, and of course, chronic pain. So be aware of that. Thymosin TB4 or thymosin beta 4, again, a vital role in tissue repair. Not only tissue repair, but angiogenesis, the production, the making of new blood vessels. It's also neuroprotective, aids in the repair of damaged neural pathways. What is inflammation? Inflammation is the bane of all of our existence. Inflammation is what produces disease. TB4 has an anti-inflammatory component to that. It's not just it doesn't just protect the nervous system. Folks, things don't work like that. It protects the nervous system, but also all of the other systems that are predisposed to inflammation within the body, whether it be your joints, your brain, your heart, your eyes, your kidneys, it doesn't matter. This is an all-around anti-inflammatory protective peptide. So neurogenesis, protecting with myelination, promotes neurogenesis, stimulation of the growth of new neurons. Hey, I want to grow as many new neurons as I can. Enhances myelination. So if you destroy that myelin sheath, and think of it this way, if you have an electric wire and you put that plug in, you can touch the wire, right? You won't get a shock. But if you take the plastic off of that wire and you touch those exposed wires, you're going to get a shock. And that's exactly what the myelin sheath is the plastic around that wire. If they're exposed, there's going to be a dysfunction. There's going to be a short circuit. So patients with neurodegenerative conditions that have inflammation that will reduce myelin, this will help repair and maintain and protect the myelin sheath. Again, reducing inflammation. And again, don't forget, accelerating healing, tissue repair, and angiogenesis, right? Angiogenesis is new blood vessel formation, all right? And that's a TB4. Cmax. Well, Cmax is, again, a very potent neuroprotective agent, memory, focus, retention. Don't forget that memory is dependent on what? Sleep. You imprint what you learn during the day when you get into the delta waves and deep patterns of sleep. If you don't sleep, you cannot imprint in your brain what you experienced and what you learned that day. So once again, we're coming back to this, which is the importance of sleep. And you can start to see how, and I'll show you at the end, how all of these fit together. So Cmax, once again, potent neurotropic, and again, look up here, memory retention and focus. That's how you remember this. Cmax, memory retention and focus. Potent neurotropic, enhancing cognition, memory, facilitating learning without hormonal activity. So it's strictly nervous system is the way it goes. Increasing BDNF, brain-derived neurotrophic factor, which is critical for neuroplasticity or the ability of your brain to think. Performance, cognitive performance. Executives, people that need that extra brain function, if you will. It's neuroprotective once again. So people that have had strokes, etc., this is a great option. Patients experiencing cognitive decline, professionals that need a little bit more focus, stroke recovery patients, and again, individuals with ADD and some learning disabilities. And you can see where the targeted areas are on this. Selank. Anxiety. Why are you stressed? Why are you anxious? What do you have to rule out? What's your vitamin D level? What's your vitamin B12 level? What are you eating? Are you eating inflammatory substances? All of these are going to make you nervous. Are you a menopausal woman? Are you an andropausal male? What's going on? So, making sure, once again, that the foundation for using all of this is solid. It will just make the peptides work better, and it will make the patient better and make you better because you are now actually doing medicine. One of the things that I tell people all the time, and when I teach physicians and I do these type of courses, I say to them, you first need to be a good clinician. You have to be able to rule out the obvious. Don't miss the obvious. Don't miss a Lyme disease. Don't miss an underactive thyroid. Don't miss a low vitamin D level. These are all part of what I'm talking about here today. So, Selank, stress relief, mental clarity. I had a young lady that came in probably now 2 months ago, young girl. She was in college, couldn't think. She said that she had ADD, she had ADHD, she couldn't think, she couldn't function. She was a photography student. I did blood work on her. Folks, her vitamin D level was in the single digits. It was non-existent. Her B12 level was less than 200. I put her on vitamin D because I thought about Selank. I thought, wow, she's really stressed. She's really nervous. I said to her, let's do some blood work. Let's see what this shows. 2 months later, a month later, able to think, able to function, able to do her homework. All her anxiety was gone. Now, if it wasn't gone, I was going to look for some other reason, and then Selank becomes an option because it's an anti-anxiolytic. I would much rather use this than using Buspar, right? I mean, and you look at all of the potential side effects and all the nastiness that it produces. So it's an anti-anxiolytic. It's non-sedating. This is one of the issues with a lot of the SSRIs and the anti-anxiolytics. What do you get? The sedating effects, the weight gain effects. None of that's happening here. And the whole idea of expression of the genes in the GABAergic system. Again, gamma aminobutyric acid, very important for the brain, and all of the other brain protecting enzymes and effects that it has, and it's non-sedating. So patients with generalized anxiety disorder, individuals experiencing high chronic stress, patients seeking non-sedating anxiety relief, and those that need a little bit more focus under pressure. Optimize the individual and go from there. So this is what I talked about before and how to stack some of these, and I'm not going to read all of this to you. You can read it, but I think part of the issue here that we have to be aware of is look at the whole patient here, folks. Don't just peptides are phenomenal, right? Peptides are signaling molecules. And if somebody ever asks you, what is a peptide? What's the elevator speech? The elevator speech is a peptide is a sequence of amino acids that their ability to signal diminishes as you age. Just as you start to lose your hormones when you age, you start to the inability to make these peptides severely goes down as we age. So giving the body the tools that it needs to do what it normally does is what this is all about. This is very simple. This is not complicated, but use it and use it in a way that becomes a whole treatment system. The neuropeptide arsenal, NAD, right? Cellular repair, mitochondrial repair, cellular energy, excuse me, mitochondrial repair, DSIP, it restores deep sleep, circadian rhythms, Cmax, focus, cognition, neuroplasticity, Selank, anxiety. Remember, Selank, anxiety, calming you down. TB4, neurogenesis, and repairing myelin. And again, reducing inflammation. So the stacking on this, again, you can look at this and you can just look at the whole patient, look at the whole picture, and go from there. All righty, that was a quick one. If I'm
I'm
happy to
happy.
take some questions if you have any questions, folks.
Perfect. Dr. DeSilva, while waiting for some questions to come in, can you talk about your thoughts on stacking of the peptides, whether that be in one vial or separate vial? That's something that comes up pretty frequently, whether that's with patients or it's with providers, about thoughts on that. Anything from stacking, whether it's the glow or a Wolverine, like a TB500 and a BPC together, or if those should be taken separately.
Wow. Great question, Heather. I think it depends on the patient, right? I really think, for example, if you have somebody that has a shoulder injury or a knee injury, okay? I play a lot of tennis, so a little bit of shoulder discomfort. What I want to do is I want to, and folks, this is not something that you start with, okay? Start with something simple and build from there. But again, just for me, I will inject just right around the joint. I will inject the BPC, BPC 157, because it has those direct effects. And I will take the TB4 as a shot, right? I'm saying here, but it's as a shot. So what are you trying to do? That is where you would use that separately. Using it together, if you've got systemic inflammation, let's say you have, and I know that these are all medical professionals on here, so I can use, if you will, disease states. Let's say you have osteoarthritis. Let's say you have an inflammatory condition. Okay, you can use the Wolverine stack. Why not? Let's say you want to build some collagen. Let's say you are a 50-year-old, 60-year-old. You want to build some collagen and you have inflammation. You have these joints. Okay, we can use glow. So I think it needs to be individualized as to what the patient is looking for. And I said this during my presentation when we were in Atlanta, and I said, ask the patient, what are you looking for? What are you looking to achieve? And then customize it, if you will, from there.
Great. So then it sounds like there's also a compliance piece in there. So you're talking about the injection site, where they've got an injury going, and then also kind of figuring out what's going to work for their lifestyle. And then the compliance aspect for the patient. It sounds like it's a big one that you see.
Great, that's good. Another point. There are some people who just don't like to inject, right? Like myself. I don't, but I do it. So I will use Wolverine, and it's great because now I can use glow. So it's a combination of the GHK copper. I can use the BPC and I can use the TB4, and it's one shot, right? So yes, again, compliance becomes a really big issue with this for people who don't like needles.
And then thank you. And we had another question that came in regarding checking the liver and whether that should be, and I think the question is, should they be checking it at the beginning? Should they be checking it throughout the course of these peptides and anything different? And because Dr. DeSilva, you do have common sense supplement line as well. And so, taking things orally versus by injection and how we measure the health of the liver then.
Great. Again, this is okay. So this goes back to what I said in the beginning, Heather, is be a good clinician first. You would never give somebody testosterone, estrogen, progesterone without having some baselines, right? I mean, if I'm going to do, and I've been doing BHRT, I've been doing bioidentical hormones for 25 years. If I have a 55-year-old woman who's coming in, I'm not going to just tell her to take estrogen, progesterone, testosterone, and write a prescription. No. What am I going to do? I'm going to check a mammogram. I do a transvaginal ultrasound because I want to see the thickness of the uterine lining. And then I will do some blood work. What's your estrogen level? What's your progesterone level? What's your testosterone level? What's your free testosterone level? What's your DHEA, et cetera, et cetera. So I have to have baselines. And this is the same thing when you start any therapy, any modality. Do the baselines. Check the liver. Check your CBC. Look at the platelets. Look at all of these things. And then, do you need to do it every month? No, but you should do it. What I like to do is do it every quarter, every 5 months, at least twice a year. At least twice a year, just do some baseline blood work. That's just good medicine.
That makes sense. Thank you. And so this question looks like we're kind of going back to regarding the peptides. This question is do they maintain the effectiveness if they're in the vial in interactions? And so that goes back to where there's a lot of questions and confusion in the industry. And so when we have a process where we're manufacturing things in an environment that is CGMP process, ISO 9001 certified, and at that level where everything is being tested from the API itself to the finished product, what as the manufacturer that they are looking for, what we are looking for is the end result, right? So when we go to do the testing on it, is it holding up to the potency that is on the label of that vial? And then again, when that the top is opened of that, is it maintaining that potency? And so Aguirre Sciences follows the same protocol that a drug manufacturer would, and that's a 10% swing one way or another. And so, as an example, if something is labeled as 100 milligrams on the vial, it has to be a minimum of 91 milligrams or a maximum of a 109. And that is the same thing of if it's a blend or not a blend. And so in the case of blends, you can have where the pH of it is different. And so you've got to blend the pH to get it to stay in solution. Otherwise, it will fall out of solution, it will crystallize, it will congeal, all of those different things. And then you also have situations where one drug may actually sort of cannibalize another drug. And that's why there's testing that's done and products come with a C of A. And so, Dr. DeSilva was sharing his experience and what he looks at as far as on the compliance side. So just wanted to answer that question in relation to on the testing side of it. And then oh yeah, go ahead, Dr.
No,
DeSilva.
I was just going to say, Heather, that's a great explanation. We've done the homework with regard to these stacks, right? The reason we put BPC, TB4 together is because we know they work together. And that, for example, to give you an example, what BPC does is that BPC produces the scaffolding, if you will. And think of it this way, right? If you have something that needs to be repaired, you need scaffolding. So that's what the BPC does. It gives you the body the scaffolding. What the TB4 does is that it allows the cells to deposit on the scaffolding so it has something to sit on. We know that. And we also know that physiologically it works together. We can put copper in there because, as Heather said, it won't quote unquote cannibalize what we're trying to achieve. Now, can you arbitrarily just start mixing stuff? The answer is no. When I say mixing stuff, I'm talking about mixing it right in the vial, right? I mean, you could use them together, but mixing them in the vial, there's a pH issue, as Heather said. There's an issue of one acting against the other and the molecule breaking. So there's a lot of pieces. Leave that mixing to us in the vials. We'll do it from our facility. But if you have any questions, and that's what we're here for, we will help you with that.
Amazing, good. And then this other question that we have here is something regarding claims that NAD increases cancer cells. And the question is, can this be true? And if so, do we have an approach for testing this? and imaging for all cancers. This is a little bit of a vague
Mhm.
question here. And so maybe this is an anonymous person who put this here. So maybe you can elaborate that on a little bit more. But Dr. DeSilva, do you have any comments related to NAD potentially increasing cancer cells?
I think anything that increases um, that increases the whole idea of cancer is very scary. And this is where screening comes in. And I said this before. If you just start arbitrarily using things without appropriate screening and getting an appropriate history, if you're concerned about something, I mean, what do, right? If it's a 50-year-old man, I'm going to check his PSA. I'm going to make sure I have all of his blood work. If this is a woman, I'm going to do, as part of my workup. If you're over 50, you should have a mammogram. What did your mammogram show? But this is another reason to follow the blood. If you feel that there's going to be an issue, do the screening before and follow them appropriately. And this is the other thing. I will not treat people for anything, whether it be hormones, whether it be thyroid. I will not treat people if they don't do follow-ups. If you don't come in, you're not getting your treatment. Period. End of story. So I think that this is something where a conversation comes in, Heather. This is where a good history comes in. This is where blood work comes in and making sure you're following the right steps, the right treatment. But again, if you're suspicious, anytime, and I'll say this, I use my medical intuition all the time. If I feel intuitively something is not right, I don't do it. Because we have that intuition as a sixth sense. It's called the vagal nerve, right? If you're not sure about something, don't do it until you rule things out. I mean, again, that's a very hard question to answer, Heather, but I hope that gives you some guidelines.
Yeah. So, and just doing a quick search here, it sounds like there's some things. I've definitely found a lot more that it does not. And we're not trying to boost anything to super physiological levels, of course. It looks like there's a little information like on some, we'll say more of the bro science things, looking if their NAD, boosting NAD could potentially help to maintain their survival of cancer cells. And so it's not necessarily a stimulation of, but if there's a situation where it was helping with the survival of cancer cells.
Mhm.
I think your response was adequate there. And then another question here related to testing. Yes, all testing is done by a third party. And so we're checking for endotoxins, potency, sterility, any heavy metals, and all of those. And so all those would be available through MedShift. And then let's see here. So a lot of offices using NAD. And then in conjunction with NAD, Dr. DeSilva, do you feel like MOTS-C would be beneficial? And would that be beneficial to all the patients using NAD or to some?
To some, to some, because the mechanism is different, right? The mechanism, it's cellular, it's mitochondrial energy, it's cellular energy. But like, for example, if somebody has um, renal issues, that has kidney issues, their GFR is low, they're hypertensive, they're diabetic, and they have a GFR that's in the 20s or even in the teens. Is there a role for SS31? Yeah, and the answer is yes, because what it does is that it stabilizes the cardiolipin membrane on the mitochondria. So we know that, and that those papers are there, that research is there, the data is there on that. Patients that have cardiovascular disease, that have very, very low mitochondrial energy. They've had, various cardiovascular diseases. Yes, there's a role for that. Do you need to do both at the same time? I'll tell you what I do. I don't. I will do one. I will do that for X number of weeks and then perhaps overlay it with a little bit of an overlap after that. So I am very, very conservative on how I do these things. I don't stack 20 different things together. No, because what you're going to do is you're going to confuse the body with the signaling because these are signal molecules. Don't overstimulate the body. Be reasonable when you do these and be very methodical on how you do this.
Wonderful. And so we've got a few minutes for just the last questions here before we wrap up. We've got another question that came in that said, how are these peptides being used while they are on the FDA's Category 2 list? And thank you for asking that. That's a great question. So the FDA has a Category 1, a Category 2 list, and then they've got, so for a long time, there was a list with the FDA that was a list of drugs that were nominated. And those drugs included GHRP2, GHRP6, CJC, AOD, and many of those were up there for over a decade. GHRP6 and 2 were an example of that. And so while they were under review with the FDA, compounding pharmacies had free range to go ahead and make those. And those we made in a 503A, so patient specific compounding pharmacy. And then at the time that the compounding pharmacies were doing amazingly well, producing the GLPs while on drug shortage, the FDA came in and took one fatal swoop and reclassified many of those peptides that were on the list that they were being looked at, essentially the whiteboard with the FDA, and put them on the Category 2 list. All of those things, and then the 503Bs have a different list they're able to make from. As a manufacturer of peptides, it is a adjacent to side where many of these regulations have not been fully written yet. And that's where you see that we're able to work within the guidelines, within the regulations. And in doing so is to have only peptides that are from FDA registered, inspected facilities, all with C of A's, facilities that we can show chain of custody on those, and then making them in an environment that is up to CGMP standards, ISO 9001, and only selling through licensed practitioners. So never selling anything direct to consumer, and also not labeling of anything that is for veterinarian use, not for human use. Nothing is showing that it's under a clinical trial, because we know that providers are not doing IRBs, right? Nobody's doing a true clinical trial. So the vials produced and shipped from Aguirre Sciences through only strategic partners such as MedShift are going through clinical use only. And so we work very carefully with a team of attorneys, 3 different ones in different areas of focus, ensuring that we're doing everything the right way while many of these regulations are being written still. We've got just a couple more. And then as far as preservatives in the peptides, there are, yes, the peptides have just a small trace amount of preservatives, and that's why things can be labeled as a multi-use vial. And that is all. So I'm going to just close this up here. And then if there is another topic that everyone would like to hear, please get back with MedShift and let them know. If cognition is great and you want to do a deep dive more into that, or want to talk about sexual wellness, longevity a little bit more, we want to focus on sleep a little bit more, please just let MedShift know so that we can work closely with them, that as they are one of our preferred strategic partners. I'll turn this back over to Jamie. If you have any final thoughts, Jamie.
First of all, I just want to say thank you so much, Dr. DeSilva and Heather, of course, for helping to coordinate this webinar. We love collaborating with you guys on this type of education. Again, as Heather had said, to everyone who joined us, thank you. If you have questions, you can certainly follow up with us directly. You can reach out to us at sales@medshiftrx.com, or you can find our contact information at medshiftrx.com. We welcome the opportunity to communicate with you. Let us know how we can serve you better if you have a suggestion for a future educational webinar. And again, everyone, have a great night and thank you.